My dear friends, this is Dr. Muhammad Gouda, and this is the third episode of 100 Ophthalmology Secrets. Before I start, I would like to thank you very much for your support of the first two episodes, and if you haven't seen them yet, they will appear to you just like now. So let's go. If you think of the retina as a flower and the optic nerve as its stem, you will know Corneal's rule. Corneal's rule. If there is a damage to the retina, it will result in an acquired yellow-blue color defect. If there is a damage to the optic nerve, it will result in a red-green defect. Look at the photo and you will memorize it so easily. Of course, there are exceptions to this rule, especially in Stargardt disease. It will have a red-green defect, and glaucoma, it will have a blue defect. Number 42. A phenylphrine drop will blanch conjunctival and superficial episcleral blood vessels, but it will not affect scleral blood vessel. Number 43. 2 drops of abraclonidine will dilate the Horner's pupil. Abraclonidine is an alpha adrenergic agonist. It causes pupillary dilatation in Horner's pupil due to denervation hypersensitivity, while producing mild pupillary constriction in the normal eye. Look at this patient. I'm suspecting a left Horner. There is a ptosis, mild ptosis, and meiosis. After installation of 2 drops of abraclonidine, the myotic pupil is now mildly dilated. A reversal of anisocoria after installation of 2 drops of abraclonidine is suggestive of Horner's syndrome. Okay. Drops of hydroxyamphetamine will dilate first or second order Horner's pupil. The mechanism of action: increasing in release of norepinephrine from the presynaptic neurons. In intact presynaptic neurons, third order postganglionic Horner's, this results in pupillary dilatation. If the neuron is not intact, the pupil will not dilate. Let's go for the next slide. I have a patient of ptosis and meiosis. I will install 2 drops of abraclonidine. If it is dilated, it is Horner, most likely. If it is constricted, it is maybe normal. Okay, I will go for methamphetamine. If both dilated, it may be first or second order Horner's. If non-Horner's only dilate, it's third order Horner. Don't forget it. Number 45. A corneal ulcer is infectious until proved otherwise. You are never wrong to culture any ulcer, and any corneal ulcer that's not responding to therapy should be recultured. Number 46. There was a study of recurrence of corneal dystrophy after keratoplasty. It demonstrates that highest rates of corneal dystrophy were seen in lattice corneal dystrophy and Bowman's corneal dystrophy, whereas the lowest rate was macular and Schneider-Kirslin dystrophy. They identified simple recurrence as bimicroscopic finding in the graft pattern, while clinically significant recurrence was defined by either presence of recurrent corneal erosions or decreased visual acuity. Number 47, there is a typing error. Treat dry eye patients if they are symptomatic, even if their exam is normal. Rose Bengal stain will show signs of dry eye earlier than fluorescein angiography. We will treat them if they are symptomatic, although their exam is normal. They may be looking normal, but they are not normal. Number 48. If there are significant complications with refractive surgery in the first eye, please do not proceed with the second eye in the same day. And here I'm opening the debate about this secret of this advice. Me myself may violated this topic several times due to overconfidence. Prostaglandin analogs are the most potent lowering eye drops with favorable side effects and easy to use. However, prostaglandin analogs and myotics are contraindicated in inflammatory glaucomas. Remember, Zlatan is strong. Number 50. Although amblyopia is most effectively treated prior to age of 6 years, treatment can be successfully at older age if compliance is good. Number 51. If amblyopia is associated with afferent pupillary defect, a lesion in the retina or optic nerve should be suspected and ruled out. Number 52. Treat amblyopia prior to surgery for esotropia. 53. The primary causes of tearing are dry eyes, lower lid laxity, and the blockage of lacrimal system. Number 54. All patients with optic neuritis should experience some improvement of their vision. However, 5% of patients presenting with vision of 660 or less were still 660 or less after 6 months. My last slide for today. An abnormal MRI in a patient with optic neuritis is the strongest predictor for developing multiple sclerosis. 65% of the neuritis patient with white matter lesion on MRI will develop MS at 10 years. I would like to thank you. I would like to thank every one of you, and we will continue after Ramadan, inshallah. Thank you for watching and thank you for support, and I hope to subscribe to my channel if you like the video and share it if you like it. Thanks a lot.